Assalamu alaikum and welcome to Medicower. I'm your host for today, Robina Mir, and this series of programs is very much around your health and what we can do to help you to understand how to take better care of yourself. I'll be regularly speaking to a doctor on various topics of health so that hopefully together we can all learn about how our bodies work and how we can make sure we take the best care of it. So today in the hot seat I've got with me Dr. Liz Bartin.
Hello.
Hello, Liz. You're a doctor who's not only a GP, but you work in the hospital system as well around diabetes.
My special subject is diabetes. So I work in general practice and I also work at St James's Hospital, but I'm also what's called a gypsy, which is a GP with special interest. So that special interest is diabetes.
Wonderful.
And diabetes is a very topical problem, I'm afraid.
It is. We do hear a lot about diabetes and obviously we come across it regularly in the South Asian community. And I think we all think we know what diabetes is, but I'm not convinced we always do. So can we start off by actually looking at
I think you're right there. I think if you ask most people, they'll say, oh, diabetes is sugar, but they won't quite know what they mean.
We actually call it that sometimes. Yeah.
Well, some people call it sugar diabetes, don't they?
Do they? Right, okay.
So let's explain. Our bodies need energy. We need food and energy to function on a day-to-day. We need energy to walk upstairs, but also we need energy when we're just fast asleep at bed. In bed, our hearts are working, our brain's working.
Okay.
So we need the right sort of energy at the right time, and we get our energy from eating food. And most of our energy comes from glucose. Now, sugar and glucose, very much the same thing, but sugar is a term that covers different sorts. So there's fructose, there's glucose. So I'm going to talk really about glucose because that's what we measure, really.
So we're not talking about just sugar that's white and comes in the packet and we put in our tea and cakes.
Right. We're going to talk about glucose.
Okay.
Now, our bodies, to stay healthy, need the right amount of glucose, the right amount of energy. Not too much, not too little. And we maintain that balance via a chemical messenger in our blood, or a hormone, which is called insulin.
I've heard of that.
Yeah, most people have actually. But what most people don't know is where insulin comes from.
No.
So insulin comes from the pancreas. And the pancreas is sort of just underneath, just behind our tummy, that area.
Quite deep.
And the pancreas produces insulin. We could even say, and I've heard you say this, Robina, the pancreas is an insulin factory, and you're absolutely right. And a healthy pancreas is on a 24-hour shift. It can produce insulin any time of the day or night, and it does that when we eat something usually. Okay. So when we eat our cheese sandwich, our body produces insulin so that we have the right balance of glucose in our bloodstream.
So what's that glucose doing then?
Glucose is giving us energy.
Okay.
So our muscles need energy to walk upstairs, our brains need energy to be working, our heart needs energy to be pumping. So every part of our body needs energy, and that comes from the glucose. Too much glucose and we'll feel tired, we'll feel weary. Not enough glucose and we'll feel disorientated or confused or really not very well and could even pass out. So we need the right balance. Enough insulin to balance the sugar, too much insulin and the sugar goes down, too little insulin and the glucose goes up. So our pancreases need to be making the right amount of insulin for us.
So how do we actually know that we're having a problem with our insulin? Is there something that's going to create symptoms so that we're going to come and want to see the doctor?
So you're saying how do I as a doctor diagnose somebody has diabetes?
And how would I as a patient know that I need to speak to somebody medical about it?
That's an interesting question, because for a lot of people they will not have any symptoms of being ill.
Okay.
Most people expect if you have a condition, a medical condition, you're going to feel poorly. But for a lot of people having diabetes, they feel completely well.
Right.
However, for some people, diabetes will cause them to have high blood glucose levels, and as a result of that, they may feel tired, they may feel thirsty, So they're wanting to drink a lot.
Yep.
And Robina, what happens when you drink a lot?
Go to the loo a lot.
You go to the loo a lot. And that might not just be during the day, but they might find they're getting up once or twice during the night to go to the loo.
Okay, so that's going to have quite an impact on the quality of your life and interfere.
Then you're absolutely shattered the next day. And actually, if your blood glucose levels are really high, some people can lose weight. Right. So some people will be prompted by feeling unwell. Forgot to tell you, blurred vision. That's another reason.
Okay.
So there's various things, but the majority of people nowadays, it's found on a routine blood test. So the blood test may just be part of a health check.
Or like those well-women checks.
Exactly, yeah.
Okay.
I mean, it may be that people have a family history of diabetes. It may be some ladies had diabetes when they were pregnant, so they need to be regularly checked. That's called gestational diabetes.
Yes, I've heard of that.
And that's a diabetes that comes on when you become pregnant and can very often literally disappear when the baby's born, but it does mean you are at an increased risk of becoming diabetic in the future. Oh. And the way we do it, it's really very simple. We take a blood test from here, usually. And what we do is we literally measure how much glucose is in the blood. And we know what a healthy level of glucose is. So we know if your level is above that you have diabetes.
Now, I've heard of diabetes described as type 1 and type 2. So what's the difference?
That's a really, really important question, and I'm so glad you asked it. And I think we really need to explain that well so people understand. Okay. So let's talk about type 1 to start with. Type 1 diabetes. Now, do you remember we talked about the pancreas producing insulin?
Yeah, that's the factory.
That's the factory. Now, what I think we also mentioned, well, we haven't actually, but I want to make it very explicit at this point, type 1 diabetes is very often found in children or young people.
Okay.
And what's happening is that their pancreas stops working. So from being quite a healthy pancreas, all of a sudden, and it can be quite dramatic, that pancreas cannot make any insulin.
So that factory's shut down?
The factory has shut down.
Okay.
And it can be sometimes a very dramatic shutting down. So the child or the young person can become really quite ill.
Okay.
And it becomes, you could say, a medical emergency to go and have the blood test done to make that diagnosis and then to start on insulin treatment.
So very serious then?
Oh yeah, because the problem is your pancreas cannot make any insulin, so you need to be having insulin.
Right.
So that is type 1. A pancreas which is shot to bits and can't make insulin.
Okay.
But it's quite a different story when we think about a type 2 person with diabetes.
That's very common in our communities.
Yeah. Well, common for a lot of people as we get older. Because do you remember, well, let's think, for instance, as we get older, things change on the outside.
They do.
A few grey hairs, a few wrinkles, and that's on the outside. And we've got something similar going on in the inside.
Okay.
So we can have a pancreas gland which is effectively wearing out. It's getting old.
Oh, so the wear and tear effect.
Yeah. So instead of making that much insulin, perhaps it can only make that much insulin. Not as much insulin as we really need to get that balance of the insulin and the glucose right.
Okay.
So some people's pancreases will still be going strong when they're 85. Other people's pancreases may be wearing out when they're only 40. So another question is, well, why have I got diabetes and I'm only 40 and that man over there is 70 and he hasn't? Well, why do some people go grey when they're only 30? Why do some people get horrid arthritis when they're only 30?
Yeah.
Because everybody's different. And so some people do have a pancreas that wears out sooner than other people.
That's really useful to hear, but I'm under the impression that diabetes is something that a lot of us could prevent as well, and that doesn't sound like that's the bit you can prevent.
Well, you are spot on there, and I think what I want to emphasise is 2 reasons for type 2 diabetes. One is the pancreas that's getting old, but definitely, and probably the more common reason, is because the insulin that people's bodies are making is not able to work properly.
Okay.
Why can't it work properly? Because a lot of people with diabetes are quite overweight. And what's happening is they have a lot of fat round their middle.
Okay.
And this fat round here behaves literally like a brick wall. The insulin cannot get through. It's hitting a brick wall.
Okay.
Only a bit's getting through. So
that's just to do with tummy fat, it's not to do with other fat?
You're absolutely right. It's fat round here. It's not so much fat legs or a fat bottom. It's this fat here, which is chemically a bit different and pushes the insulin away.
Because some people are pear-shaped, some people are apple-shaped. And
I'm talking about the big fat tummy shape.
Yeah, so that's the apple shape.
So what you can do is get a tape measure and measure your waist circumference.
Okay.
Because there's also an ethnic difference. You mentioned about a higher incidence of diabetes in Asian people, and you're right, probably 60% of the whole world's people with diabetes are Asian.
Really?
And we could probably explain that because Asian people tend to have less muscle and rather more fat in proportion to their body weight.
Okay, didn't know that.
So, yeah. For instance, if you have a little baby, let's say an Indian baby, a Pakistani baby, if you could do imaging on the baby, you would see, compared to a European baby, slightly less muscle, slightly more fat, and a higher insulin level. Okay. So the differences there predispose somebody who is from Asia to being more likely to have diabetes.
So does that mean that every community has something that they're more likely to have compared to other communities?
Yeah, I think very often that's the case.
Okay, so diabetes is the one that we need to watch out for the most. So diabetes is something
we definitely find.
Okay.
So just going back to why people get their type 2 diabetes, it's this insulin, and we call it insulin resistance. Right. The fat causes insulin resistance.
So that wall you were talking about.
Yeah. A bit like we talked about cars earlier. If you have a car which instead of getting 50 miles per gallon from the petrol is only getting 25 miles per gallon, that's because the fat is stopping the insulin working properly.
So what's happening to the insulin that's not getting through?
Nothing.
So it's just wasted?
It's just wasted.
Okay.
So
it's not at optimum level, that's what you're saying?
So the knock-on effect from that is if people lose some of this fat or never accumulate it in the first place, but usually for most people it's lose the fat, then they will find their diabetes will improve because the insulin can get through.
Well, that's easier said than done, isn't it?
Oh, without a doubt. But we need to be explaining to people so they understand how they can help themselves. Because people, my experience, rather than taking medicines, tablets, etc., if we can do something ourselves to help and prevent, prevention's better than cure.
Yeah, and obviously this programme is very much around helping our communities to understand how they can take some control of that.
Can I add something else?
Please do.
I'm talking about lifestyle, and lifestyle to me is not just the diet we're eating, but it also includes physical activity. Now, that can be very difficult because most of us lead busy lives with family commitments, etc., and finding time to do physical activity can be difficult, but it will make such a difference.
Are you just talking about going to the gym, though, or are you talking about other
I'm talking about any sort of physical activity. The best activity is where your heart beats slightly quicker. So it might be going for a walk, not just a little stroll, but walking up a hill, possibly even becoming slightly out of breath.
Yes, I've heard it said that good exercise that's aerobic is where you can walk at a pace where you're slightly breathless, but you can still have a conversation.
You can still have a gossip with your friend.
Yeah.
Perfect.
Okay.
So doing physical activity, and the reason it works is it sensitizes our body to the insulin that we are making. So again, we get more out of the insulin. We grab hold of it and we make it work better. So physical activity isn't just joining a gym. Gyms can be quite expensive.
Yes.
Physical activity is going for a walk, maybe getting off one bus stop sooner.
Or parking your car away from the supermarket or a bit further away.
Yeah.
But it's not all outdoors either. I mean, isn't vacuuming and gardening and other things just as useful?
You go shopping and you use the lift to go to the top floor. Well, don't. Walk up the stairs. even instead of sitting using the remote control for the television, get off your bottom and go and press the button. You might only walk half.
I'm not sure everybody knows where those buttons
well,
are.
no, actually, gosh, yeah, you're true there. Yeah.
I think we're so used to that control, aren't we?
Gardening, fantastic. Cleaning the car. I mean, there's all sorts of ways of getting activity. And some people who maybe their legs aren't so good because they've perhaps got arthritis, we can still do quite a lot of activities using our arms. So don't forget that physical activity is really important.
It is about moving then, isn't it?
Moving.
Even if you've got to build it up gradually.
Yeah, absolutely.
Okay, so that's a really good tip that we need to remember. Okay.
So anybody who's worried about diabetes, and we now recognise a time called pre-diabetes. So perhaps somebody's had a blood test done and it isn't so high that we're saying you have diabetes, but we know the level of glucose in the blood is slightly higher than it should be. So we know the chances are that person is going to develop diabetes unless they start to do something about it.
So this is quite a crucial time then, if you're being given that kind of message.
Very important.
To think about, this is the time I can stop myself from getting into that range of being a diabetic.
Because how often have we heard people say, if only I'd known, I'd have done something about it. Well, now this is a golden opportunity where it's not easy though, thinking about what you eat, thinking about your weight, considering physical activity can make a huge difference. So I'm not saying, Robina, we'll prevent that person becoming a diabetic person, but we can perhaps prolong the time until they are diabetic.
So a longer episode of better health than being unwell.
Exactly.
I was told by somebody that actually if you can lose 10% of your normal body weight, you're going to have a massive improvement in your diabetes if you're diabetic already.
I have to say, losing any amount of weight, if you set your goals too high, it gets difficult and you become disillusioned.
Yes,
so saying to somebody, you need to lose a stone, you think, oh, gracious heaven, how will I ever lose a stone? Whereas if somebody says, what about thinking of half a pound every week, every other week, that becomes achievable.
Yes.
It's something you can go at slowly and gracefully. Whereas if you don't lose that stone in the first month, you're thinking, oh, gosh, I failed. Oh, what's the point? I'll go back to it. But just having an easily achievable, and that goes with the physical activity. Just saying, I'm going to find 5 minutes to go for a walk.
I think we're really good at understanding the theory side of this. I know from my own perspective how difficult it is to actually incorporate that consistently into my life. And I guess it is about that mindset where you change your attitude towards it and think, this is important because I need to prioritise myself at this point. Yes, I've got to make the dinner. Yes, I've got to go to work. Yes, I've got to do all the chauffeuring that I do for the family and whatever else I'm involved with. But actually, I need to allow myself permission to prioritise me for that bit of time that puts my health at the top of the tree.
The other thing I would say is we have a responsibility to be looking after ourselves. So it's not just a matter of give me a tablet to make me better, give me a tablet to make it go away. We have a responsibility for our own health. So we can use our knowledge about lifestyle to improve things.
We've talked a little bit about medication and lifestyle. I've had a question from Brother Azad in the community, because one of the things I was doing before we came on air was to ask people that I know about whether they've got questions about diabetes. And his question was, are there any natural ways of controlling diabetes so I don't actually have to rely on medication?
Well, let's go back to what we were talking about, lifestyle. So we tend to think treatment for diabetes is all medication, it's all tablets or it's insulin. But actually, what we should start to understand is that our lifestyle is part of that treatment program. So the diet we eat, losing weight, the exercise, those are all things we can do and should be doing even if we're on treatment or even if we're not on treatment. So I would say lifestyle, a crucial part of looking after our diabetes.
And what about families? We've had a question from Aksa as well. She said, in what ways can family members support someone diagnosed with diabetes? She's got a mum who's got diabetes and she's a young adult and she's thinking, what can I do to support my mum?
Right. Well, here we go again. You're going to find me saying the same things lots, Robina, and I'm not going to apologise for that, because the basic problem with diabetes for a lot of people is the food we eat, the weight we are, and therefore watching the food we eat and having sensible diets and watching how much we eat, because that is often a very important thing. A lot of people can eat very sensible, healthy meals, but what they're really doing is eating more than they should.
So
Portion control.
What kind of portion control is something that we're hearing about a lot at the moment. But you've also talked about the types of food, and you've said that, you know, sugar is part of that. But we're not just talking about sweet things, are we?
I think that's a really important point again, because most people think diabetes, sugar, sweet food, chocolate, cakes, biscuits, pastries, all these sorts of things. But what a lot of people have never learnt is that other foods can be converted into glucose once we've eaten them and they've been digested in our bodies. So, for instance, I'm going to talk about carbohydrates. So I want you to think about your starchy foods. I want you to think about bread, potatoes, rice, chapatis. I'm a Yorkshire lass. Yorkshire pudding. I'm a Yorkshire lass again. Chips, potatoes. So all these things, which
the best things on the
don't
plate
seem to be sugary, but when I eat them, they will be converted into glucose. So sometimes some of my patients will say, Dr. Liz, I don't eat sugar, I don't like chocolate, and we never have cakes, we never have biscuits. But I talk to them and I say, well, tell me what you've been eating. Packet of crisps, they love their pasta, they had chips. So understanding that those foods will be converted into glucose once they've eaten them, it starts to make sense why they're struggling with their diabetes, their blood glucose levels, and also struggling to lose weight.
So is this like putting too much fuel into the car that's not being used then?
Yeah, I suppose it is really, yeah. Okay. So, because if we take too much in, it will be converted to fat. And we've just been talking about the problem with the fat.
So these are all the connections.
So your question about how can a family support a member who's of the family with diabetes, it's helping them with their diet, being sensible about portions, and also how difficult is it to have a very sensible diet when the one person on one side, the person on the other side is tucking into 4 chapatis and you've only got 1. Their pudding is chocolate cake and your pudding is a yogurt or a piece of fruit.
It is so hard.
And then the other thing, here we go again, physical activity. It's that girl saying to her mum, oh, look at the time, we're not having tea for an hour, let's go for a walk, let's walk down to see Susan. It's a Sunday afternoon, let's go for a walk round the park. So it's encouraging people. It's even saying, I'm going to join a gym. Do you want to come with me? I'm going to go to a Keep Fit class. Or will you come and help me do a bit of gardening? Encouraging somebody. It's always more difficult to do anything if you're on your own, isn't it?
It is. And of course, not everybody's got somebody that's available at the same time that they're there. So I guess what I'm listening to is very much around the importance of that, but also what I'm challenging you on is the reality of how some people struggle with that. And I guess I can find the response to that is very much around starting smaller chunks maybe and then aim to build it up.
Finding 5 minutes to go for a walk, and then after a week maybe you make that 10 minutes. But you're saying about how difficult it is, and it is difficult, but we have a responsibility to keep ourselves healthy.
And I think that's the message that we all need to hear really. It's about us taking that responsibility and recognising that we are responsible for looking after us as individuals.
And very often, and I suppose because I see a lot of ladies, as mums and wives, we're looking after our family. We need to be well and healthy to look after them. So we deserve to have time to look after ourselves.
Absolutely.
And that might be saying, no, I'm not making tea yet. I'm going for a walk for 5 minutes.
Okay. And on that note, we need to go to the break.
Right.
We'll see you back in a short while.